Hello, everyone. Welcome to our YouTube Live. I am just pulling up something real quick here. Welcome. Today we are talking about how to catch up on notes. So I have talked about this in a few videos, but it's actually been quite some time since I did that. Let me know if in the chat if you can hear me okay and everything's good there. But while I wait for something like that to come through, yeah, we've talked about this a few times before. We've talked about how to catch up on notes, and there's kind of a two-step process. So we're going to break that down into 4 steps that you can easily follow. And if you don't know me, haven't attended one of these before, my name is Dr. Maelisa McCaffrey, founder of the free private practice paperwork crash course. And one of the big things that I actually do is more than even teaching on documentation at this point is help therapists catch up on documentation. So help people catch up on their notes. And it's a huge, huge issue that's really, really common. Most therapists think they're the only one experiencing it, and that is absolutely not the case. So today you're going to get some very practical tips for how to do that, how to catch up on notes. All right. So we are going to talk about why therapists tend to fall behind in notes, how to avoid falling behind in the first place. Then we're going to go through what you have to do first when you're behind in your progress notes, because there is a really important first step. And then we'll talk about 2 simple ways for creating a catch-up plan. And then I have a little bonus tip for you as well. And I think hopefully the sound is okay. It looks like maybe it's a little low. I've got to work on my input at some point, but we'll keep going if that is okay for everybody. All right, so let's dig into why therapists tend to fall behind in notes. And there are a few reasons, enough that I actually have an entire webinar on this topic. So it's that common, and there are that many different things that could be impacting people. But the main one that is kind of an overarching theme is that therapists are really not confident in what they're writing. So if you're unsure about what to even put in your notes, then it becomes, number one, a really long task, long and or laborious. So even if it doesn't take you more than 15 minutes to write a note, maybe it does take a lot of your mental energy and kind of zaps the energy out of you. So I find, those 2 things create a really negative experience with writing notes if you're unsure about what to put in them and you're constantly questioning yourself and doubting what you're putting in and rewriting. And then that leads to avoidance. So, it could be avoidance of the task because it's just so uncomfortable and brings up so many feelings of inadequacy and shame and wondering what to do. And it kind of starts making people go down the spiral of, am I a good therapist? Because I don't even know how to put into words what I just did with this client. There's that part of it. And then there's also the practical part of, if it is taking you half an hour to write a note and you see 20 clients in a week, that's a lot of time. And it's very difficult. Most people don't have that much time just for writing notes. You have, a personal life, you have other things you need to do in your practice, you need to actually see clients. So between just not having the practical time set out and then having it be such an uncomfortable task that you want to avoid it, this very easily leads to falling behind in notes. So that's the most common reason I see. Some other reasons are, other really practical things, like someone with chronic pain who really has trouble with things like migraines. And so sitting at a computer, looking at something where you need to type gets really difficult, or just the act of sitting, right? People who have had like surgery recently and they're recovering, or people whose parents have had a major medical thing and now you're going back and forth and traveling to different people's homes and taking care of people. And so all of that has both an impact on your time and your mental energy. And if you don't feel confident about making notes, or like if notes aren't just an automatic quick thing for you to do, then any of those things that come up in your life are going to have a significant impact on writing notes. And as a little aside here, I will also say that typically writing notes is the first thing that goes. So if you are starting to feel burnt out, or if you're starting to feel overwhelmed, or there's starting to be too many things on your plate, you're not going to stop seeing your clients first, and you're probably not going to stop fulfilling other responsibilities first. Notes tend to be the first thing that you stop doing. So it can be a really good red flag, especially if you're a supervisor. It's a great red flag that something is going on with your supervisee. It doesn't mean that they are, a bad therapist or that something is massively wrong. It does mean something isn't working, and it's time to investigate what and why. All right. Like I said, I have a whole webinar on that topic. So I will move on and we'll talk about how to avoid falling behind in notes in the first place. And the first and easiest way to do this is to schedule it. And so a lot of people really underestimate how much time it takes them to write a note. So you can't schedule writing notes if you don't know how long it takes to write a note. So I do recommend, and in my paperwork catch-up group, this is the first assignment everybody has, is time yourself writing notes. So have a few clients, if you saw a few clients today, write those notes and just time them. Don't judge it, and don't worry about if it's long or short or how long it should be. Just write them as you normally would, and get an idea of how long it takes you to write a note on average. Then once you have that number, you can actually schedule the time. So a lot of times what will happen is sometimes people will actually do this task, realize they only spend 5 minutes writing a note, and that it's more that they dislike the task and they didn't realize it was that quick. And so knowing that it's that quick kind of solves the problem in itself, because then it makes it easier to motivate yourself to get it done. On the flip side, sometimes people do this task and realize, oh, it's taking me 30 to 45 minutes to write a note. And then you realize what I was talking about earlier, that this is not sustainable. You cannot see 15, 20, 25 clients in a week and spend an hour on everyone's progress notes, right? It's just not going to happen. So depending on where you are, after you do that scheduling task or that timing task, it'll help you figure out how to schedule your notes. And if you're kind of in this mid-range, I would say 10 minutes is an acceptable time to spend writing a progress note. Then it's just a matter of figuring out where it fits in your schedule and not throwing it in with other things. So a lot of times people will have like an admin day or admin time and assume they're going to get everything done together. But guaranteed notes are going to be the last thing on that list. And you're going to do emails, and you're going to call people, and you're going to work on insurance things, and you're going to work on your website or schedule a networking coffee. You're going to do all the things before you're going to do your notes. So they really need to have their own scheduled time. So how to avoid falling behind in notes? Schedule. Schedule them. Related to that, another way that you can avoid that is by making the process a little bit more quick and easy. So, I emphasize both of those because, again, it's not just the time, it's also the mental energy. So if you've watched almost any of my videos, you've probably heard me talk about use bullet points, use phrases. There's no law that you have to write your notes in a full sentence. None that I'm aware of anyways at this point. And it's much easier to review notes from a reviewer perspective, to review notes that are in bullet point format. So start writing your notes that way. That doesn't matter what template you're using. It doesn't matter what section of the note it is. It doesn't matter however you work, unless you have a supervisor who's telling you can't do that. You can enact this practice today, right now, the next note that you write. And it will make it easier. And that process will even get easier as you do it more often. So if you can make notes feel a little less overwhelming and less like a daunting task, then when you have it scheduled, you will be more likely to follow through. So that's why I'm sharing those two tips together, because I do feel like they go hand in hand. Schedule the time, but also make it a little bit easier to get those notes done. And no, it is a process. It will, this all takes some time. All right, so let's talk about what you have to do first when you're behind in progress notes. Because the actual catch-up process is sort of two main things. It is number one, getting current on notes this week. So number one for catching up on notes, ironically, is actually just don't continue falling behind. So this process of getting this week's notes done is really key for an ongoing catch-up process, because otherwise I can create a catch-up plan with you and say, okay, spend all this time and we can schedule all of it, and you'll wear yourself out. And then at the end of it, you'll just avoid the notes again and get behind again, right? So I see this a lot where, and a lot of people have had this where it's a cyclical thing. I fall behind, I catch up, I fall behind, I catch up. So we want to avoid that by not first focusing on the actual catch-up plan, but instead focusing on that schedule. So number one is just get on a schedule and stay consistent with it. And it might take you 2 or 3 months to figure this part out, and that is okay. Consider this part of the catch-up process. Part of the catch-up process is, when do I actually get my notes done? Right? So schedule that time and play around with it. And I always tell people in my catch-up groups that this is an experiment. It is unlikely that you're watching this or, whether live or later, or, that you're in my catch-up group and this is the very first time you've ever had this issue and tried to do something about it. You've probably tried multiple things, right? So this new schedule you create, it would be normal for not every part of it to work 100% of the time. Instead of I say that because I know what therapists tend to do is then beat themselves up about it when it doesn't work out. So instead we use that as information, we practice self-compassion, and we say, okay, so this didn't work. How come? What can I look at to do a little bit differently so that I can be consistent? And you'll get a lot of insight. So it's a very self-reflective process, but through that process, you're able to create sustainable and lasting change. So once you get onto a consistent schedule, which, like I said, might take months, it might take many weeks of trying something out, adjusting it. And there might be like, it works on Mondays, but not on Fridays for whatever reason. Be flexible and get creative with different ways you can do this. Once you have that set and you're mostly getting your notes done on a consistent basis every week, then you tackle the older notes. Because really, at this point, some of those notes are 6 months old, a few years old, right? Those notes are already old. They're not really, they're going to be old 6 months from now, and they're old today. So I would rather you focus on feeling better about notes and staying consistent first, and wait to create the catch-up plan when you have a little bit of success behind you to be motivated to get it done. And it will feel far less overwhelming if you already know this is something you can do. You've kind of proven to yourself, I can actually get my notes done. So once you are on that consistent schedule, then we're going to create the catch-up plan. So I'm going to give you 2 tips for creating your catch-up plan. And the first is, you can do it. I actually have like a big, PDF catch-up plan, and I think there's some great self-reflective exercises to do as part of that. But for the purpose of this quick tip video, there is a really quick and easy way to get notes done. And so even if you're scared of actually counting, I know a lot of therapists are like, I don't want to look at how many notes I actually have to do. I know it's a lot. It's hundreds, right? You don't have to do that as part of this process. All you have to do is have a piece of paper, like you can handwrite it next to you, or you can have it on your computer, and write down all of the client names for whom you need to catch up on, right? That's it. And then when you go to catch up on notes, you just pick a name from the list and you work on one client at a time, and you go down the list. And for some people, they like choosing the client that has the fewest amount of notes to do, because that feels doable and it's like you get to cross somebody off. I love giving you a quick win. go for it. Some people do start off with the clients that maybe they're like feeling a little uncomfortable about and need, feel like this record really is the one keeping me up at night the most, and I want to get this one dialed in and feel like I can be confident if something comes up. That's another way to reduce the stress around being behind in notes. And I do recommend you just do one client at a time, because you're not having to mentally switch during the catch-up process. You can kind of sit down for an hour and just get a bunch of notes done. I know it's not quite always that simple, but in general, that's what I would recommend. Just checking to see if anybody has. If you do have questions or comments, feel free to type them in the chat. Okay, so number one is just make a list of clients, go down that list. And that way it's really nice because it gives you some flexibility, but also some structure, right? Now, when do you do this? So the second tip is schedule a time. Schedule a time to do it. So now this does not have to be a couple hours every week. It doesn't have to be that you spend time every day or even every week. This could be for a lot of people, like for example, for me with ADHD, a lot of times I'm better if I have like a block of time to do something rather than doing it like every single day. So having a get notes done day. We do those in my community where it's a full day every month of getting notes done. And of course it's, sometimes it's other admin tasks and things, but that is a way that you could schedule like, okay, maybe I can do one Saturday morning a month that's just focused on getting notes done, getting older notes done. So you have your current schedule all set. Now, on top of that, I can commit to this, few hours a month. And I know a lot of people will be like, well, but that's not that much. But the thing is, you're already behind, and not scheduling and giving yourself unrealistic expectations is more likely to lead to this never happening, or to it being a much, much longer process. So I would rather you schedule realistically based on what you can actually commit to, and just make some progress towards it. And yes, it does take people a lot longer to get caught up than they usually think it will, and that's okay. You will get caught up if you follow this plan, like what I have just outlined. You can follow that, and you'll be caught up. It might be in a year, it might be in 2 years, it might be in a few months, but you'll do it. And you'll do it without feeling totally overwhelmed and like you can't do this anymore. That is always my goal, is I don't want this to be a process that you feel you cannot sustain long term. So related to all of this, and then I will answer your question. I will share a link in the chat for the paperwork catch-up group. I think that one of the best ways to catch up on notes is to get support around it. I run a catch-up group for therapists, and we meet for 14 weeks and we create the plans together, and we have a support group every week, and you get to vent, you get to share what you're struggling with, you get to receive support from your colleagues and also give support to them. And we really focus on having micro goals, like every week. Okay, what is one little thing you can do this week to make sustainable progress towards your ultimate goal? And having that support is transformational, is the word that people use more often than anything else. So I really do feel like having support is huge. If you are not able to join our paperwork catch-up group, this support aspect is still really important. So is there another therapist that you feel comfortable talking about this issue with, and maybe they can help keep you accountable, or you guys can check in on a regular basis, or you can meet together to get notes done, maybe on a monthly basis. Is there, maybe someone in your personal life, a friend, a partner, someone that you could talk to who would kind of get it and you could lean on for support? You really need support, because what I find is that the second you reach another barrier, which is going to happen in life, like that's just part of life, right? You're not going to have 4 months go through and everything's going to be perfect. But as soon as you hit that little barrier, it's so easy to stop, and it's so easy to beat yourself up and to think, how did I get here? How did I let it get this bad? Um, why does it always end up like this? I can never catch up. All the things, right? And that is what we want to avoid, because that is not if you're a therapist, you know this, that is not a helpful place. And it's very difficult to problem solve when you are in that shame spiral. So we want to avoid that by having a supportive community where you can go and get those reminders. So that is what we offer in the Paperwork Catch-Up group. I'm going to put that link in the chat there so you can check it out if you're interested. And yeah, please do ask any questions or comments on catching up on notes. So DG asked, do you have a checklist on what is important in a note that insurance expects to be in the note? I do have a checklist. I think it is a handout somewhere. So it's not really that different what insurance wants to see versus kind of in general, when you put all the ethics codes and common laws together, what needs to be in a note. And so I kind of base this checklist off of that. Really, the only difference with insurance is that they specifically want to see ongoing progress and ongoing need for therapies. They want to see your client is actually making some progress in therapy, but simultaneously continues to need it. So I have some videos on, I have a video specifically on that and on how to write a progress statement. That's the most common thing I see missing in people's notes when I look at notes. Most therapists are really good at writing interventions and including that, and then including things like topics that are discussed in the session, and often like the plan moving forward, and even the assessment section most of the time. But the progress section is absolutely the most common thing I tell people. The only thing you want to add is that. So we will link to that video. After I get off here, I'll update that and we'll put that in the description. We'll have a link to that progress statement video, because that's what I would direct you to. There's also a video I have on like what goes in a progress note. So I'll include both of those links below so you can check those out. All right. Well, if we don't have any other questions or comments, I think I have given you like the quickest rundown for how to catch up on your progress notes. I know that there's a lot more to it than that. I know that when you do start this process, a lot of questions start to come up, and that's what I'm here for. So that's why I run the catch-up groups, so that as you are working through the process, you don't get stuck on, I don't remember what happened in this note from last year. What do I put in it? We have templates for that so that you can feel confident just moving forward and keep going. That's always my goal. I also do individual consultations. So if you're watching this at a time when enrollment is closed, or you still don't quite feel comfortable with that process, that's fine too. All right. Well, YouTube is going to run an ad in like 30 seconds here. So it's a good time to wrap up so we can finish that. And no, Sarah, who asked this question, most therapists, counselors do not learn these skills in school. And that's because it's nearly impossible for a class to give you what you would need in different settings. We're too varied in our work and in our roles to have very specific guidelines. And that's why all of our ethics codes and even a lot of our state laws are fairly vague on what to include in a progress note. So now I do think supervisors need to be a little bit better about knowing these things and teaching this to people. And that's who would be the person that ideally would be teaching everyone, Sarah, is the clinical supervisors. So if you know someone who is a clinical supervisor, please direct them to my website and to this channel. And I always encourage supervisors. We have supervisors in the catch-up group. I do consultations with supervisors. They are really the ones that need to take on that role in training you in the setting you're in. right? Because you could be working in a prison, you could be working in a school, a hospital, a private practice, a community mental health agency, and all of those settings require very different things to consider. And so those supervisors in those fields are really the ones who need to take on that role of passing this information down. All right. So yeah, thank you for that question, because it is a really, really common one. A really common thing that I hear is I never learned this in grad school. And I think that's okay. But what's not okay is if you asked someone for help in a clinical setting and they didn't offer it. Supervisors really do need to be teaching these and getting this training. And a lot of people find me and start getting my trainings because they want to become a supervisor and realize, ooh, like I don't even feel comfortable with this. So I need to get some help here. So I love working with supervisors. All right. Do I offer consultation groups? Not consultation groups, but I do offer consultation on like specific cases, especially related to documentation. So if something dramatic happens with a client, I have done those type of individual consultations with people. And in the catch-up group, it's more like a support and accountability group than an actual consultation group. So, but you never know, TBD. So as of right now, not for consultation. All right. Thank you for your questions, everyone. Thanks for being here. Check out the links in the chat. We'll also put a link, or in the chat, in the description below, I'll also put a link to the catch-up group down there in case you want to check that out and you're watching the recording. Thanks, everyone. We'll see you next week where we continue our AI series. And until then, happy writing.